Hello everyone. So today we are going to start with our new topic of ENT, that is the clinical anatomy of the lateral wall of nose. So before beginning, first let's recall our first year that there we have also studied the dangerous area of the nose, okay, which consists of the upper one third of the lateral wall and the septum through which the infection can spread to the intracranium. Okay, now, before beginning, that we also just know that the lateral wall of the nose are the projection of the three bones, which is known as the concha or the turbinates. These three turbinates are the superior, middle, and inferior turbinates. Okay. Now, the largest one it is the inferior, which occupies the whole of the length of the lateral wall. Okay, and above to it is the middle turbinate that occupies the posterior half of the lateral wall, and above to it that is the superior turbinate which occupies the posterior one third. Okay, now the superior and the middle terminates are the part of the ethmoid bone, whereas the inferior terminate it is an independent bone attached to it. Now you can see in this diagram carefully that it is here. It is the inferior terminate which occupies the entire length, middle terminate which occupies the posterior half, and the superior terminate which occupies the posterior one third. And here it is the inferior terminate which separate bone articulating with ethmoid superiorly and maxillary bone laterally. Okay, now we also see that is the meatus which lies lateral to its corresponding turbinates. So if it is here is the turbinates laterally to it is the meatus. Okay, now before beginning we starts with the ethmoid bone. So in this diagram we can see that is the parts of the ethmoid bone, that is the lamina papyracea which is situated in the upper part. So laterally it is the lamina papyracea, which is a thin papery bone separating the nasal cavity. This is the nasal cavity and the orbit. Okay, and it also forms the medial wall of the orbit. Now below to it is the uncinate process, which is a sickle shaped bone which forms the lower boundary of the hiatus semilunaris. Okay, now here is the perpendicular plate of the ethmoid. Okay, it forms the bony part of the nasal septum. Okay, now above to it superiorly it is a cribriform plate which separates the nose from the anterior cranial fossa. Okay, now we can also see in this diagram that is the crista galli. It is a median ridge of the bone that projects from the cribriform plate of the ethmoid bone. Now lateral to the turbinates, between the turbinates and the, just a minute. Okay, now lateral to the turbinates, between the turbinates and the lateral wall, there are respective meatus we have also discussed. So as we can see in this diagram that first inferior meatus, middle meatus, superior meatus. Okay, inferior meatus it is the largest one, middle it is the most common to be get congested, and the superior is the smallest one. So here in the inferior meatus, so first start with the inferior meatus. It lies lateral to the inferior turbinate. Okay, which is the largest turbinate, hence it is the largest meatus. If it is the largest turbinate, then it's the largest meatus. Okay, now in the inferior meatus it is the opening of the nasolacrimal duct. Now if a patient comes with a swelling of hair in the orbital areas, so what we will call due to the nasolacrimal duct obstruction, so in this case the treatment part will be the either the Krigler massage of the nasolacrimal duct in the direction of the DBL, that is the downward, backward, and laterally. Otherwise, the surgery, that is the endoscopic dacrocystorhinostomy, that is a direct opening from sac made into the nasal cavity. Now, for the evaluation part, we can do the diagnostic nasal endoscopy. Now, endoscopy is done with the help of the rigid endoscope. They are of different angles, that is 0 degree, 30 degree, 45 degree, or 75 degree, or other flexible endoscope. Now for examination, there in three pass endoscopic examination of nose is done. So in the first part, the inferior meatus, nasopharynx; second pass, superior turbinate, superior meatus, and sphenoethmoidal recess; and the third pass it is the middle meatus. Now this is the endoscopic diagram. We can see here it is the septum and lateral, that is the lateral wall of the nose. sorry, here it is the septum, and here we can see the lateral wall of the nose, because in the lateral wall of nose we can see here the structures, that is the inferior turbinate. Above to it, it is the middle turbinate. Okay, and it is the floor. In this diagram also, this is the inferior turbinate part and lateral wall, and here in the inferior turbinate part, it is a opening of the nasolacrimal duct. Okay, opening is in the opening of nasolacrimal duct, it is in the inferior meatus, not in the inferior turbinate. Okay, because below to the laterally to the inferior turbinate, it is the inferior meatus, and from there the opening of the nasolacrimal duct is occurs. Okay, so here we can see that is the coronal cut section of the CT scan. So in this diagram, though lowermost part it is the inferior turbinate, above to is it is the middle turbinate, and above to it, it is the septum. Okay, and this one is the whole maxillary sinus. Okay, now moving to the middle meatus. Okay, this is the most common meatus approached endoscopically to diagnose and to treat. Okay, it lies lateral to the middle turbinate. Okay, in the middle meatus, it is the opening of the anterior group of sinus, that is the maxillary, anterior ethmoidal, and the frontal. Okay, so that's why it is known as the most congested meatus. Okay, now the frontal sinus opens into the anterior superior part of the middle meatus. Okay, now the one structure that is the in the osteomeatal complex, that is the bulla ethmoidalis. It is the most prominent anterior ethmoidal sinus which appears as a bulge in the middle meatus. Just below to it, it is the uncinate process. Here it is the uncinate process of ethmoid, and in between the bulla and the uncinate, it is the hiatus semilunaris. Okay, and through the hiatus semilunaris, we enter to the three-dimensional area. Here is the bulla ethmoidalis, and here is the uncinate process. Below to it is the hiatus semilunaris, and here through the hiatus semilunaris we entered into the 3D area, that is the infundibulum, into which the opens the maxillary sinus directly. Okay, and all these structures which are constituting the osteomeatal complex. Okay, now the middle turbinate, usually it is not pneumatized. Okay, the pneumatization of middle turbinate, it is known as concha bullosa. Okay, concha bullosa, it is a pneumatization of the middle turbinate. Okay, now this bullous turbinate blocks the drainage of the middle metal area, leading to all three sinusitis. Okay, and the middle turbinate, it is usually concave towards middle meatus. Okay, now, clinically, we have also seen that the forms a common drainage pathway of for the anterior group of sinus. Most common, it is a sinusitis. Now, for applied aspect, here the surgery name is FES, that is the functional endoscopic sinus surgery, in which the right rigid endoscopic is used, and the first step, it is the removal of the uncinate process, that is the uncinectomy. So we can see clearly in this diagram, that is a middle turbinate, there is a lateral wall. Okay, middle meatus, uncinate process, and so in the first surgery, that is a functional endoscopic sinus surgery, the first step, it is the removal of the uncinate process. Instruments used are the first blackless sleeve nasal forceps, backbiting forceps, and for the CT scan, here we can see that is the bulla ethmoidalis, uncinate process, infundibulum, and the maxillary sinus, and here it is the uncinate process. So here it is the superior meatus, that is the opening into the superior meatus, it is posterior ethmoid. Okay, note, so one note is that the sphenoethmoidal recess lies between the sphenoid and ethmoid above superior meatus, and the content, it is the opening of the sphenoid sinus. Okay, so there are various sinuses opening here, and one is the sphenoethmoidal recess, that is the area above the superior turbinate. Okay, through which the sphenoidal sinus open, and it is also known as sphenoethmoidal recess. Okay, so if we know that the important structures, that are the eustachian tube, sphenopalatine foramen, Okay, that is situated in the floor of the nose, which is sphenopalatine foramen. It is located 1 centimeter behind the middle turbinate on the perpendicular plate of the palatine. Okay, what is its significance? The most common site of origin of the angiofibroma and the entry for major vessels and nerves supplying the nose. In this diagram, we can also see the sphenopalatine foramen here and the perpendicular plate of the palatine. Here it is the medial pterygoid plate. Okay, so let's end up here. Thank you so much, guys. Please like, share, and subscribe this channel. Thank you so much.